It's all about me. Real love, sex, security. It's all about me. Real love, sex, security.
Sexuality is the key. Happiness is what I choose to be. Taking back the power of the fear that lived in me. Health and wellness is what I really need.
Hi, I'm back. Dr. Catherine Emarula. Call me Dr. Cathy. For those of you that don't know me, I am a board-certified family practice physician, integrating holistic medicine into my practice. And many years ago, after doing a lot of holistic stuff and trying to balance people, I realized, oh my goodness, I was getting results in one particular department, the sex department. And I decided that's my niche. I'm going to talk about sex with my patients to try and connect them back to their health. Greater health, greater sex, greater sex, greater health. That's my belief. And I really want you to believe that too. So here I am trying my best to give you the power, give you the information you need to improve and maximize your sexual experience, your sexual function for both men and women. All right, so last time I spoke to you guys, we talked about sensations. We did visual, we did hearing, auditory, and we did touch. All right, this time we're going to talk about smell. All right, so with that, I actually drew a diagram that shows how we smell, okay? This is the olfactory system, and we have the brain, which is where the olfactory bulb lies. And that olfactory bulb is very important in capturing the senses of smell, which are chemosignals. Okay, so chemosignals are the smells that are turned into chemicals. And when they're turned into chemicals and we inhale them, they go into our nose, to the olfactory epithelium right here, and through this controversial organ called the vomeronasal organ, or Jacobson's organ, right there. So these two structures basically are in charge of our smell. And they say that the Jacobson's, or the we call it VMN, is really the one that is in charge of our pheromones. Okay, so our pheromones are really what the Jacobson organ really smells, and that's again controversial. They say that we don't smell it, but you know we're going to find out in the future. I'm sure that we do, but the other smells that we have are sensed by the olfactory epithelium, and they both go through these neurons, which are here, into the brain, the hypothalamus, and it stimulates us and gives us all these different feelings and is connected to our behavior. A lot more studies have to be done on it, but the truth is that you're going to find that when you smell something, it makes a big difference in one's behavior. And people smell us all the time, and I don't even know if you know that you smell yourself, right? So we do. And the most important thing for you to understand is that's the connection right here, that you actually have a detailed, well-organized system to smell. Women smell much better than men. That's what they say. I'm sorry, guys, but they say we smell much better than you. And we have trillions of smells out there that we can differentiate. We know that animals and mammals do it because we know that that's what attracts them to their mates. So it's important for you to know that you are actually also involved in that, right? Using the pheromones. So we have so many different ways of smelling our partners. And again, if you're smelling and you start to lose that smell, I'm sure those that have lost it during this COVID-19 time understand the significance of how different your life can be. And if you actually have a poor smell, you're going to actually have problems choosing your partner. That's right. So right here we have some samples of smells, okay? Semen, breast milk, vaginal fluid, stools, urine, pheromones, tears, saliva, hair, menstrual fluid, sweat. So these are just some samples of oils, lubrication, secretions that are actually formed by us, men and women, and they really, really do have what we call chemosignals, chemical messengers that we actually are not even aware that we smell. And when we smell them, they actually affect our behavior. We can be attracted or repelled by someone based on these smells. So it's important for you to understand how important each of these are. I'm going to take them one by one. Semen. Whenever you are smelling semen, you'll find that it is dependent on what the person eats. Yes, there's some genetics in it too, for all of them. But what you eat can actually go into the semen, guys. And we women are sensitive to it also. Can we turn on? Can we be turned on and turned off? Yes, we can. So it's important for you to know. It's important for you to actually have an idea of what you're eating before you engage in sexual intercourse with your partner, because you can actually turn off your partner based on what you eat. They say meat, which can also be found in your sweat organs, right? You can actually turn off your partner with eating meat, because meat, for some reason, breaks down and degrades, and we do not like that smell. They say that it can be a predator sort of thing versus a prey sort of issue when it comes to meat, because that meat has some blood in it. And when we talk about menstrual fluid, we'll talk about that a little bit more, but you'll find that there is a lot of information when you actually look at the studies that the semen can actually be turned off, can turn people off when you have a lot of bad foods that you eat. Processed foods is always my excuse to stop, because you don't want that to go into the semen. And you want to have healthy sperm, so you don't want to have cells that are not being produced with great nutrition, okay? Breast milk. Breast milk is also something, of course, that sometimes guys will taste during sexual relations, and you'll find that you actually have things in there that we produce, medications, foods, again, that really can influence the breast milk taste. Sometimes when someone is ovulating or menstruating, you can also change the sense, because there's more oxytocin and there's a lot more chemicals released. But the guys will tell you that they don't really see a difference, but there is some sort of non-awareness of being able to know that you actually have an attraction or an aversion to someone based on, again, their smell. Yes, their taste too. But with their smell, I would say that the pheromones are so intertwined in this, it's really hard to differentiate them. But I would always advise us to just know that be aware of what you eat, be aware of what you drink. You know, you want to be as natural as possible to get great nutrients from your body. And that great smell, the chemosignals, you want them cleaner, you don't want them affected. Because they do say that when you take certain medications, like even birth control pill, you can turn them off. Stool, feces, we already know what you eat is going to be in that. Urine, there are a lot of things in urine, right? We break it down in our liver, and when you break it down, you'll find that you are not able to know what you're breaking down until you study it. So the urine has its own smell, right? Based again on alcohol, drugs, you can smell it. You can just, it's so strong. The question now is that going to affect you sexually? Yes, it can. Again, men and women, depending on what you eat, depending on genetics. There are some toxic things that can affect your hormones too that are in here. I do a test on urine to check for toxic metals, to check for estrogen breakdown, and to check for even simple poisons that one can have in the system. So you really, really want to be careful that you're not eating something that you don't even know, like arsenic, that could be in your urine. Okay? Vaginal fluid, we know about vaginal fluid, that if there's an infection going on, an STD going on, you're going to be able to smell it sometimes. You want to make sure that the vaginal fluid is nice and clean by, again, making sure you visit your doctor and do your physicals and get your STDs checked. And also by knowing that in the vaginal fluid, that is where, again, some of the pheromones are, right? So the pheromones really are androstenedione and androstenone, and they actually are a lot in the fluids in the vagina and in the sweat. So those, again, are your pheromones that, to name a few, that really do affect and attract partners whenever you are sexually stimulated. That is playing a role, pheromones, right? Then we have saliva, which you can taste, again, based on what you're eating, based on genetics. There are other things, other chemicals, other breakdown products, fatty acids, bacteria, things in there that are just signature for you, which is almost like a thumbprint. They say that your pheromones or your smell is really only you. There's no other person that smells like you. So you've got to remember that what you do, whether you eat certain foods, whether you take certain medications, whether you scrub your skin off with alcohol, you need some of that bacteria, right? I'm always really a big supporter of bacteria, that we need the good bacteria to fight and build our immune system. Tears. There's a study that says that if a man smells tears, and the tears are of an unhappy source, if someone's very unhappy, they can actually get low testosterone, get depressed, get turned off, and not be attracted to that person that's producing the tears. So it's very important to know how influential these secretions are, including your tears. If it's tears of joy, they can tell there's a big difference, versus tears of sadness or tears of grief. So it's very important to know that when you're crying, it's not that you can't cry, it's just that you're going to impact someone just based on the smell of the tears alone. Menstrual cycle. So some people like to have sex during the menstrual cycle, and some people don't. I think that again is an individual discussion. Some people say it's good, and some people say it's not good. Personally, to me, it's just an individual decision, because you really have some great benefits. For example, it reduces pain, reduces congestion inside the pelvic area, which will actually give the lady more discomfort relief, so that during sex she will actually feel better. So some people like it, some people don't. But again, there's nothing wrong with it. There's nothing dirty about it. It's just a matter of preference. Back in the days, we do know that men stayed away from women because of it, but now things have changed. People know that it's not as dangerous as they used to say. Okay? Then the hair. Ooh, the hair can be a big, big source of pheromones, and you really want to have a good sense of clean hair, but not too clean. So when it's too clean, you start smelling the chemicals and getting all the synthetic stuff, which I'm not really into. You want to have more of a natural hair or a natural smell, which means you really want to make sure there's not too many chemicals that can make or mask the pheromones that are coming from the hair. I know everyone washes their hair at different times of the week, but you have to make sure that it doesn't go too long, because again, bad bacteria can grow and fungus can grow and make the hair very, very nasty, and you don't want to have that smell of dirty hair, which again can be a turn-off for some people. Yes, I'm sure there's a turn-off for some people, but for most people, you want to have good hair, because again, this is all connected to your immune system. Last but not least, sweat. Very important. Again, axillary sweat, behind the ears, legs, groin, under the breast. The whole skin is covered in sweat glands, and you'll find that you are really turned on when you have a great amount of certain pheromones, especially if it's during the ovulation time of a woman. When a woman ovulates, the guys know, they can smell it. Pheromones again being released, that's what they say. Pheromones are being released during the ovulation time. So you need to know that if you take a birth control pill, you're turning it off. You're not really getting the ovulation hormones, you're not getting those secretions that will attract a guy. So the guys really do not know whether you are ovulating or not if you're on a birth control pill, but they say that they do know when you're fertile, at your most fertile point, which is when you're ovulating. When you're not taking birth control, they actually do know. So when they say that men know when you're menstruating, know when you're ovulating, it is true. But they're not really aware of it. Studies still need to be done. We have some studies. I have studies. If you want some studies, let me know. I'll send you some more studies that show that, men really, really, especially when they live with you for a while, they really know that you are on your menstrual cycle, believe it or not. Okay? Now, I have this shirt here because of a study that came out years ago where they said men wear for 2 weeks a shirt, right? Don't change, don't use any deodorant, don't use any cologne or perfume. And they had the women smell these shirts after 2 weeks. About half of the women were on birth control, the other half of the women were not on birth control. So you had some people that were not menstruating, not ovulating because they were on birth control, and those that were not on birth control were actually ovulating. And it appears that the women that were ovulating were attracted to the men that had a certain amount of pheromones. And they did the study again with the same people, and they switched out the people that were ovulating or on birth control and not on birth control. And they found that the people that were attracted to the men that were on birth control were attracted to the same people off birth control because of the smell. And it appears that women really know from their smell, the mate smell, who they're going to mate with. And there are some studies that show that you actually can tell, a woman can tell, who is a better mate versus another male based on the smell, because the smells have what we call MHC, major histocompatibility proteins, that actually will tell us your immune system. And for me, that's huge. Your immune system is what we want, because when we have children, we want to have a diverse immune system that we can match with our own, and have children that have a much bigger immune system, which actually will make them much stronger and make them survive much better in the future, and as adults and as growing children. And we find that a lot of people don't realize that these are things that are going on unknowingly within us. And when we actually choose our mate, part of that is so that we can have stronger children, offsprings, and propagate, right? And continue the generation upon generation of our seeds and our offspring. So it's very important to be able to smell. And one of those things that will affect smell is, we already know, COVID-19, allergic rhinitis, right? Allergic rhinitis can actually take away the sense of smell. And you have to be aware that men that have, and women that have allergic rhinitis have lower sex drives, don't sleep, and have more fatigue. There are so many connections to protecting that area of the nose where you smell. If you have allergies, you really want to be aware. Get it treated, get it cleared up, because you don't want to have bad allergies. Of course, I do allergy testing, and some people don't believe in them, but I really do believe in finding out what you're allergic to and reducing the amount of allergies that you're having, because it can affect you in terms of not only sexual function, but in terms of tiredness and in terms of your fatigue and your sex drive and your sleep. They say that sleep also is affected by it too. So very important to be aware of the importance of smell, which means you want to keep that airway nice and clean and nice and healthy. Again, greater sex, greater health, greater sex. If you're having issues with your smell, please follow up with your primary care doctor, an ENT, and make sure that you have someone that can actually evaluate you and find out, why have you lost your sense of smell, if you have. For those that have a great sense of smell, enjoy. There are so much other things that we can talk about, and so many other things we can go in terms of directions, in terms of trying to figure out how we can enjoy ourselves in the bedroom using all sorts of different smells. But I guess the take-home point here is smell is crucial. Yes, we're still studying how important it is, but we both know that if animals do it, we do it. We smell our partners and have a great time doing it also. Okay? All right, so that was the talk about smell. I will do taste next. I do want to let you know that I'm going to be doing IG Live, YouTube Live, And I do want to be able to start doing a Patreon and doing some chatting. I'm going to sell some of my oils, which I have. I have a few oils here and some supplements here that I also want to start selling on my website. I'm going to start doing some consultations, and I will also want to be able to do some one-on-ones. So I'm going to probably raffle off some free hormone testing and some free visits so that we can get you guys understanding how important that sexual function is. And I know that this is just the surface topic, right? The sensation and just talking about things more medical. We're going to get down to the nitty-gritty, which is why people have issues in the bedroom, so that we can actually have more fun one-on-one talking about things that will make a difference. But I have to give that general overlay, that general information about how you can really improve your sexual function by understanding certain senses, okay? So next time, stay tuned. We're going to talking about taste, and the taste is going to be interesting, because I know that we are always tasting all sorts of foods, right? And more. All right. Thank you guys for your patience. I will see you guys next week. Take care. Bye.
It's all about me. Real love, sex, security.